Hello, my name is Elena Weaver, and I am here today to talk about my capstone experience in Nursing 482. I'm a native of La Crosse, Wisconsin, and a soon-to-be graduate in the University Viterbo School Class of 2020. In my spare time, I'm also an in-home hospice nurse technician and a volunteer for the St. Clair Health Mission in La Crosse, Wisconsin. My capstone for Nursing 42 was at the La Crosse County Health Department, as well as online through ATI real-life virtual simulations. When transitioning from my clinical format to a capstone experience, I was initially nervous because I wasn't sure if I was going to be ready to face the reality of becoming a member of the healthcare team. However, by remembering that I've been able to care for many individuals with varying disease processes, backgrounds, cultures, religious beliefs, and socioeconomic statuses, I was confident in my basic nursing skill set, which includes the ability to assess patients accurately and also provide appropriate nursing interventions based upon my nursing evaluations. I relied heavily on my foundational understanding of the nursing process, which includes not only assessment, diagnosis, but planning, implementation, and evaluation. There were many times throughout my capstone experience where I felt hesitant in my nursing skills, especially when it came to applying informational technologies in order to meet the various nursing needs of patients and find additional credible resources for these patients based upon their varying diagnoses, prescribed medications, or treatments they might be undergoing. Improving these nursing skills was actually one of my goals that I identified in the first few weeks of this capstone experience. I was able to improve upon these nursing skills using technology when performing community COVID-19 exposure assessments and for the La Crosse County Health Department, as well as when participating in the virtual simulations via real-life ATI. Through these capstone experiences, I was able to accomplish another personal goal, which was to gain confidence when performing virtual assessments, skills, and nursing interventions through an online format. I had to rely heavily on my own preparation, previous experiences in these clinical situations, and fundamental nursing skills learned at Viterbo University in order to effectively care for virtual patients as well as La Crosse community members. I was able to accomplish the goal of being able to provide credible sources of information to these patients through my experience with the La Crosse County Health Department, as my job was to assess members of the community via telephone for potential exposure of COVID-19, and then I'd provide information based upon their responses. Through these assessments, I was able to give accurate and up-to-date COVID information, as well as measures they should take in order to decrease their risk of acquiring or transmitting the virus in the community. Furthermore, I accomplished my goal of providing nursing care based upon evidence-based practice by participating in nursing research on the green here at Viterbo. My research was evident in this practice relating to how nurses can implement aromatherapy as non-pharmacological interventions in order to decrease patients' perception of post-operative pain while being hospitalized. I now am able to implement these evidence-based practice interventions for my current and future patients in order to provide the highest level of nursing care possible. Initially, the transition from having the perspective of a nursing student to the view of a professional graduate nurse in the clinical setting was pretty daunting, as I questioned if I was ready to take that leap. However, I think integrating my professional values, nursing skills, and evidence-based practice into my nursing care, I now feel confident and able to perform well as a professional graduate nurse. The professional values of altruism, autonomy, human dignity, and social justice have been the foundation of my nursing practice, and I've been able to make decisions for patients based upon the concern for my patients' well-being and advocate for them regardless of face-to-face contact. Although the online and audio format of patient care may have been a potential barrier that could have inhibited the integration of these values into my professional practice, I feel that I incorporated these values into my capstone experience by consistently and consciously formulating my nursing care based upon these values. Ultimately, I felt I was able to integrate these values into my practice by ensuring my patients are treated with respect, regardless of socioeconomic status, gender identity, religious belief, sexual orientation, race, age, or ethnicity, and this has created better mental, spiritual, and physical outcomes for the individuals under my care. I'm now confident With the knowledge I acquired through the Viterbo University Nursing School will provide a remarkable foundation for my current and future nursing care, and I feel confident in myself as a new graduate nurse through my experience with Nursing 482 Capstone. Thank you so much for coming to my TED Talk.